Is Dr. Nuttara Wiboonthanasarn for the entitled Efficacy of tranexamic acid to reduce perioperative blood loss and blood transfusion in patients undergoing primary malignant musculoskeletal tumor surgery.
Good morning, Chairman, Co-Chairman, and everyone. Today, I would like to present my research about the efficacies of tranexamic acid to reduce perioperative blood loss and blood transfusion in patients undergoing primary malignant musculoskeletal tumor surgery. This paper is no conflict with this presentation. As we know, many surgeons have to face a situation like this, especially the major operation of soft tissue and bone sarcoma, which are associated with increased significant blood loss and transfusion. And that leads the patients to small complications. For example, the transfusion-acquired infection and the immunomodulation effect, the transfusion-induced coagulopathy. So reduction of its use should be considered. There are many methods to reduce blood loss and blood transfusion, and one of that is the tranexamic acid, which is an anti-fibrinolytic drug that inhibits the binding sites of the plasminogen, and it decreases the fibrinolysis pathway and preserves the fibrin structure. So results of the action is to help to stop the bleeding. We reviewed many literatures about using of tranexamic acid in orthopedics field, and we found that it can reduce perioperative blood loss and blood transfusion. Moreover, it's not increased risk of thromboembolic complications event. However, current literature has not carefully defined in musculoskeletal tumor surgery. So the purpose of our study is to focus on this patient in primary malignant musculoskeletal tumor surgery. And we focus on the perioperative blood loss, number of blood transfusion, and additionally, secondary outcome is to observe the thromboembolic complications event. We include the patient with extremity primary malignant musculoskeletal tumor surgery who are undergoing to surgical treatment with the age between 18 to 85 years old, the tumor size more than 5 centimeters measured by MRI, and no preoperative embolizations was done. An exclusion criteria is shown in this table. And we randomized the patients into two groups. In tranexamic acid group will receive the 2 grams of tranexamic acid intravenously, and followed by infusion of tranexamic acid 1 gram within 8 hours. In control group, we receive the placebo in the same manner and equivalent dose. After the operation, we record the intraoperative bleeding, the volume of drained blood, the blood transfusion, and we observe the clinical of venous thromboembolic complications event as well. We use the p-value less than 0.05 to be statistically significant. So now let's move to the result. Our demographic data is shown in this table, comparison between two groups, the sex, the age, the obesity, the history of allergy, the comorbidity, and also the preoperative laboratory were no statistically significant difference. And about the baseline operation is shown in this table. Comparison between two groups, such as the diagnosis of the type of the tumor, the site, the location of the tumor, and the surgical margin, the types of the bone resection, types of the bone reconstruction, and also the soft tissue reconstruction. It's no statistically significant difference between two groups. And if you look at this graph, you can see the mean of volume of drained blood and intraoperative blood loss in tranexamic group was decreased compared to the control group. And the results of number of blood transfusion is also the same direction. And no thromboembolic complications was clinically detected in both groups. So now let's move to the discussion. The strength of our study is the first randomized double-blind study about the efficacies of the tranexamic acid in musculoskeletal tumor surgery. And as we know, that one of the major risks of venous thromboembolic complication is active malignancy. So the use of tranexamic acid might be concerned in this patient group. But our study show not significant increased risk of venous thromboembolic complication, and moreover, it can clinically reduce of the blood loss and blood transfusion. The result is not statistically significant. So we suspected from the small sample size and due to the rare conditions of the patients and variation types of the tumor. For future suggestion, it is to study in more specific type to obtain more information and detail. The conclusion, the tranexamic acid has a clinical effect in reductions of intraoperative blood loss and blood transfusion, but not statistical significant difference in patients undergoing primary malignant musculoskeletal tumor surgery. And it's no thromboembolic complication event were clinical detected. Thank you for your attention.